Hello everyone, I am Vijay Kevlani, Assistant Professor, LJ Institute of Pharmacy. Welcome to MOOC Session Series, an initiative taken by LJ Institute of Pharmacy. In today's session, we are going to talk about therapeutic drug monitoring. So as we already know that each and every drug has a therapeutic range in which that drug is active. If the therapeutic dose or the therapeutic range above that, if the concentration of drug is present in blood, it will produce toxicity. If the drug concentration is present below this therapeutic range, the drug will not produce its effect. Hence, the drug, for producing the effect, it has to be in the range, in the therapeutic range, the range in which the drug can produce action with minimal or no side effects. Right. Now, for some drugs, this range is too much small. It could be in microgram. So, change in a little bit amount in blood concentration may lead to major or serious adverse effects. So, to prevent that, therapeutic drug monitoring is one of the most important factor we can use. So, let's see what is therapeutic drug monitoring and what are the criteria. So, therapeutic drug monitoring is the clinical practice of measuring specific drug at a designated interval to maintain a constant concentration in a patient's bloodstream, thereby optimizing individual dose regimens. In other words, therapeutic drug monitoring refers to the individualization of drug dose by maintaining plasma or blood concentration within targeted therapeutic range or targeted window. Therapeutic drug monitoring involves not only measuring drug concentration but also the clinical interpretation of the results. The goal of this process is to individualize therapeutic regimen for optimal patient benefits. By combining knowledge of pharmaceutics, pharmacokinetics, and pharmacodynamics, therapeutic drug monitoring enables the assessment of efficacy and safety of particular medication in variety of clinical settings. Therapeutic drug monitoring is based on principle that for some drugs there is a close relationship between the plasma level of drug and its clinical effect. So if the plasma level of drug changes, the clinical effect will also change. Another assumption is that drug metabolism varies from patient to patient. Some drugs may metabolize some of the chemicals or some of the drugs very fast. Let's say isoniazide. So there are fast acetylator, there are slow acetylator. In that way, the metabolism of drug varies person to person. When a precise therapeutic endpoint is difficult to define, monitoring of a drug level may be of considerable therapeutic assistance. Routine monitoring is, however, not advocated for most drugs. Only clinically meaningful tests should be performed. Right, it is not necessary to perform therapeutic drug monitoring for each and every drug. The drugs which are having high therapeutic range can be excluded from this. So therapeutic drug monitoring aims to promote optimum drug treatment by maintaining serum drug concentration within a therapeutic range. So here in an image we can see that there is a therapeutic window. In therapeutic window the drug is active. Now above that, the maximum effective concentration above which the drug will produce toxicity, below which, that is minimum effective concentration below which the drug will not produce its effect. History of therapeutic drug monitoring. So the science of therapeutic drug monitoring grew out of the recognition that certain drugs have a narrow therapeutic range. In concentration above the upper limit of the range, the drug can be toxic. In concentration below the lower range of the range, the drug can be ineffective. Not all patients have the same response at similar doses. Looking at therapeutic drug monitoring in India, so therapeutic drug monitoring was introduced in India in mid 1980s and last 20 years have seen its growth. Therapeutic drug monitoring in India exists mainly in two settings: in large technical hospitals through Department of Clinical Pharmacology. Sorry. Looking at therapeutic drug monitoring in India, so therapeutic drug monitoring was introduced in India in mid 80s and last 20 years have seen its growth. Therapeutic drug monitoring in India exists mainly in two settings: in large teaching hospitals through Department of Clinical Pharmacology and in private sectors. Criteria for drug to go for therapeutic drug monitoring. So the criteria for drugs are: an appropriate analytical test for a drug and active metabolite must exist. It should be there. If an analytical technique is unavailable, it is useless to go for therapeutic drug monitoring. Drug should have a narrow therapeutic range. Patient not showing adequate clinical response to a drug despite being on adequate dose. The therapeutic effect cannot be readily assessed by the clinical observation. Large individual variability in steady state plasma concentration exists at any given dose. There are several classes of drug commonly monitored to ensure correct blood concentration, which includes anti-epileptic, phenytoin and valproic acid, anti-arrhythmic, that is digitalis and lignocaine, antibiotics, that is gentamicin, amikacin, tobramycin, anti-neoplastic, that is methotrexate, antimaniac, that is lithium, bronchodilators, that is theophylline, and immunosuppressants, that is cyclosporine. Indication for therapeutic drug monitoring. So while there may be a specific individual circumstances for therapeutic drug monitoring, most indications can be summarized as follows. First, low therapeutic index. Second, poorly defined clinical endpoint. Third, non-compliance. Fourth, therapeutic failure. Fifth, drug with saturable metabolism. Sixth, wide variation in metabolism of drug. And seventh, for diagnosis of suspected toxicity and determining drug abuse. Eighth is drug with steep dose response curve. Ninth, when another drug altered the relationship between dose and plasma concentration. For example, plasma concentration of lithium is increased by thiazide diuretics. 10th, renal disease. In that also excretion of drug is changed. Drug will stay in body for long time and hence therapeutic drug monitoring is required. Therapeutic drug monitoring is unnecessary when clinical outcome is unrelated either to dose or to plasma concentration. Doses need to be individualized. The pharmacological effect can be clinically quantified when concentration effect relationship remains unestablished. Drugs with wide therapeutic range such as beta blockers and calcium channel blockers, hit and run drugs. So for this, therapeutic drug monitoring is not required. Process of therapeutic drug monitoring. So very first, the decision is taken. So decision to request a drug level. Second, the biological response. Third, laboratory measurement. Fourth, result communication. Fifth, clinical interpretation. And sixth is therapeutic management. So initially, a decision is taken that whether to go for therapeutic drug monitoring or not. Second is biological response, in which the drug is given and response is checked at specific time interval. Third, after that, a specific time interval is selected or designed, and according to that, blood samples are collected. Fourth, result communication. So after collection of blood sample, the drug amount of drug or plasma drug concentration is measured, and based on that, results are communicated to concerned doctor. Fifth, clinical interpretation, in which doctor will interpret that the pharmacokinetic of that specific drug is proper or not, or pharmacodynamic is proper or not. And lastly, therapeutic management. So based on that, therapeutic corrections are done. Clinical significance of therapeutic drug monitoring. So very first is maximize efficacy. Second, avoid toxicity. Third, identifies therapeutic failure. Fourth, facilitates adjustment of dose. Fifth, facilitates the therapeutic effect of drug by achieving target drug concentration. Sixth, identify poisoning, drug toxicity, and drug abuse. Limitation of therapeutic drug monitoring are scientific accuracy of the drug assay, laboratory variability in reporting, limited accessibility and infrastructure facilities in rural area, validity of suggested target ranges, lack of training and skills, and cost involved. So cost is one of the most important parameter. Second important parameter is facility or infrastructure of the drug. Right, this both parameters are the major limitation to therapeutic drug monitoring in current days. Therapeutic drug monitoring and pharmacoeconomics. The measurement of drug level in body fluid must be cost effective. Mongala et al. Showed that therapeutic drug monitoring service offered substantially benefits like fewer adverse reaction, shorter intensive care unit stay, and shorter overall hospital stay. So, by therapeutic drug monitoring, we would be having the advantages of less adverse effect, short stay to hospital, and intense response of drug. Resources consumed by therapeutic drug monitoring are likely to be re- regained by positive outcome. Thus, therapeutic drug monitoring is an appropriate candidate for an economic outcome evaluation. Free drug monitoring. So, development of a new filtration device has made it possible to measure free unbound drug level in serum. The advantages are that the free concentration is independent of changes in plasma binding and is the pharmacologically active concentration. The disadvantages are that it is time consuming, expensive, and therapeutic ranges do not yet exist for many drugs. Conclusion. So, therapeutic drug monitoring may be useful for establishing initial dosing and monitoring certain medications. Therapeutic drug monitoring cannot compensate for error in diagnosis, poor choice of drugs, error in dispensing and doses, error in sampling, or non-compliance. However, when used in combination with good clinical observation, it can lead to optimal drug therapy with minimal side effects. Therapeutic drug monitoring data provides the clinician with greater insight into the factor determining the patient's response to the drug therapy. It can help to distinguish a non-compliant patient and a patient who is true non-responder. Thus, therapeutic drug monitoring is a useful adjunct in treating many patients provided the potential pitfalls and problems are considered. Frequently asked questions from these topics are: thank you. Please like, share and subscribe our channel Pharma Ignite for more updates. Thank you.